Hello. Today is World Pediatric Surgery Day, and on this day, we are going to have a small discussion on the current state of pediatric surgery in our state, across the country, and of course in our hospital. Myself, Dr. Shubhadeep Das. I'm a senior consultant of pediatrics and pediatric ICU at Narayana Super Speciality Hospital, Howrah, and I'm very delighted to have with me today Dr. Gautam Chakraborty, who is also a very dear friend of mine and the pediatric surgeon in our hospital. So we are very fortunate actually to have Dr. Gautam, you in this hospital, and there are umpteen number of times when he bails us out from different emergencies in our pediatric ICU. So we are very fortunate in that way. Without wasting much time, I'm just going to go straight away into the discussion of today. So my first question to you, Dr. Gautam, what is this pediatric surgery at all? And we all know about general surgery. So how is it different from general surgery?
So thank you for the introduction, Dr. Shubhadeep. Pediatric surgery is a surgical super speciality where we deal with only the surgical illnesses starting from newborn area, that is day 0 of life, up to 18 years. And the pediatric surgeon is a super specialist who has completed general surgery and has undergone an extensive 3-year extended training of managing pediatric surgical specialties.
Right. I think that clears a lot of doubt. So what are the common conditions that a pediatric surgeon would generally treat? And in today's scenario, where we are seeing a lot many subspecialties coming up, many super specialties coming up, where do the pediatric surgeons stand? What is the importance of pediatric surgeons in today's scenario?
Yeah, so I'll answer your second part first.
Yeah.
So if you go back a few decades, there are not many super specialties. So a single surgeon who had operated a 60-year-old patient in the morning would again operate a 6-year-old kid in the afternoon. But over last few decades, we have understood that children are small patients, but small patient doesn't mean that it is a small surgery. So they need much more better handling, delicate handling, much more technical expertise for the best outcome. So over this concept, the stream or the department of pediatric surgery was born. And if we discuss regarding the common pediatric surgical conditions that we come across, so we'll divide broadly into two categories. One is the congenital condition, that is the child is born with it, the birth defect, and the other is the non-congenital condition. So if we discuss the common congenital conditions that we come frequently across, these are absence of the foot pipe. You feed the child cannot feed, turns blue, chokes, absence of the anus at birth, the child doesn't pass meconium, has abdominal distension with green vomiting, then infection related perforation or blockage of the intestine, non-formation of the small intestine, and many other conditions as far as congenital is concerned. And among the non-congenital condition, it again depends on the system involved. So starting from head to toe, the child might have a spinal defect which resulting in accumulation of fluid in the head, enlargement of the head, a condition called hydrocephalus. If you come down to the chest, the child might have a lesion or a tumor in the chest, collection of pus in the chest cavity secondary to pneumonia. As far as the abdomen is concerned, there might be emergencies like acute appendicitis. There might be intestinal obstruction or a blockage while the child will cease passing stool and gas, will have green color vomiting, and other abdominal tumors. Trauma is one very common aspect which you come across in children, because children are very prone to trauma while playing, road traffic accident, fall from heights. Pediatric cancers, pediatric solid organ cancers. These are most common the scenarios that you come across in our day-to-day practice.
Right. Wow. So it basically tells me that there is a whole spectrum of diseases that you as doctors treat. So it's a very important field that it sends out a clear message, whatever you have told me so far. So such an important subspecialty, do all the hospitals have this facility of pediatric surgery though?
Unfortunately, that is a very dismal scenario, because not all hospitals are having pediatric surgery and not all districts are having pediatric surgery hospitals. So it is extremely unfortunate for those who stay in periphery to turn up to a center in proper time. And if you do not turn up in the center proper time, the prognosis is affected. So unfortunately, we are lacking on that aspect. Both the government and the private sector has to work on it.
So you have just made me aware or made us aware about several pediatric surgical conditions that you treat.
right.
So how can the parents be a little more aware about what are the things to see in their children so as to identify that if their children has got any pediatric surgical condition?
So let us start with the very commonest conditions. So as far as the birth defects or congenital conditions are there, we will not go into that discussion because those conditions are mostly diagnosed by the physician or the pediatrician who has attended the birth. But apart from that, the common conditions that we come across is that in case of male patients, inability to retract the foreskin of the penis, or abscess, you cannot see the testis in either of the testes in the scrotum, any swelling in the groin which might or might not increase with cough, or which can be a hernia or a hydrocele, whether the child is passing urine from the tip of the penis or from the undersurface of the penis. These are common, some urological conditions, very frequently you come across. Then any abdominal conditions like pain abdomen with high grade fever, constipation, any greenish or golden yellow vomiting associated with abdominal distension, any lump anywhere in the body. As far as urinary system is concerned, if the child passes blood in urine which might or might not be associated with pain, if the child passes blood in stool, again which might not be associated with pain. So these are some of the common conditions that generally the patients come with us, and the parents themselves give us a clue to that.
Right. So there are so many surgeries, so many conditions where we actually need your help. A question which sometimes crosses my mind is that as pediatric surgeons, can you help pregnant mothers also?
Yeah, ideally the management in the pediatric surgery as far as congenital defects are concerned starts with the antenatal counseling part. Antenatal means the child is not yet born, but the parents has to be counseled depending on some finding in the antenatal ultrasound scan, which is very much possible in the hand of an expert radiologist. So once something has been diagnosed, some anomaly has been diagnosed in the antenatal scan, it is the duty of the pediatric surgeon to sit with the parents and tell them, see, your expected child is likely to have this condition, this is the normal course of the condition, this might subside with time, we need not do anything, or this might end up in a surgery. And most importantly that we have to emphasize on that is that please get the child delivered in a center which is a pediatric surgeon.
Yes.
Because if the child, God forbid, requires a surgery right at birth, then you cannot transfer the child to a center which is 100 kilometers away from the center where he was delivered. So it is very important to counsel these parents and gradually follow up as well.
Right. Such an important subspecialty, but you are a very rare breed because in comparison to the population, the number of pediatric surgeons still in this country is very, very less. And as I have already mentioned, here in this hospital, we are very fortunate to have you. And I still know many parents face a lot of problem in consulting pediatric surgeons. So can you please elaborate on what are the problems that parents might face while consulting this subspecialty?
Yeah, the first hindrance in consulting a pediatric surgeon is disbelief on the part of the parents. They do not believe, they are not ready to accept that my child is having a problem and that will require surgery. That is quite expected. We are also being parents who are worried. Second is lack of knowledge about surgical condition. Many parents do not know that this condition is surgical. We have come across kids who are not having testes in the scrotum since birth. Parents did not notice it, did not give importance. And the child came to us at around 20 years of age himself. That, sir, I was not given proper attention and now I need treatment for this. So, lack of knowledge. Third is knowledge regarding the hospital. There is pediatric surgical facility available. And fourth is, if you know the hospital, again the hospital might be very far away from where you live. So that particular time, that golden period in consulting the doctor gets lost on the way. So these are the main problems that parents face while consulting a pediatric surgeon.
Right. But as physicians, as surgeons, can we do something to increase the awareness among the parents about these pediatric surgical conditions?
Right, that is the need of the hour, that is a burning issue. And as in any awareness, digital and print media has a big role to play. So digital and print media, within their ethical considerations, can focus on particular hospital, that pediatric surgery facilities available in this hospital, and the spectrum or the scope of pediatric surgery in that particular hospital. And second is word of mouth. Suppose my child has undergone an operation by a pediatric surgeon, it is my responsibility, it is my duty to go and tell my friends, my neighbors, my colleagues that God forbid if your child has a surgical condition, please consult a pediatric surgeon and nowhere else. So these two things are very important. And apart from that, what we can do is we can arrange campaigns in schools, as our patients are mostly children, campaigns in school, housing societies, marketplaces. So these are some very common and easy practices that can be done.
Right. So increasing the awareness among the masses is very important, because unless and until that is possible, this subspecialty will not gain adequate popularity, although it's a very, very important subspecialty. So you have already told us that you treat a lot of conditions, some of which are congenital, that is babies are born with those conditions. So if I ask you that what is the outcome, what is the prognosis of patients who are born with these surgical conditions?
Barring a few conditions like severe spina bifida spinal defect, which is already having huge hydrocephalus enlargement on the head, already there are paralysis in all 4 limbs, complex cardiac defect, and anomalies where multiple systems are involved, heart involved, kidneys involved, bones are involved, brains are involved. So these are having dismal prognosis, but barring this small subsector, most of them are having excellent prognosis. They grow at par with their siblings and are at par with their classmates, even doing good grades. So our overall outcome is very good.
Right. That's very good to know. And as we have been saying already, like our hospital, of course, offers these pediatric surgical facilities. So in our hospital, what are the different pediatric surgeries which are being offered at this point of time?
So whatever discussion we have had so far, most of these conditions we have operated in Narayana Health, Howrah, and I am glad to inform and share with you all that we are inching on to almost 300 cases in last 2 years. Discussing about this, we have operated on birth defects like esophageal atresia, that is non-formation of the foot pipe, intestinal atresia, non-formation of the intestines, absence of anus or imperforate anus, anorectal malformation. We have operated on diaphragmatic hernias where the intestines, rather than staying inside the abdomen, goes into the chest and compresses on the lungs. We have operated on tracheoesophageal fistulas, etc. We have operated a lot of trauma patients. We have operated abdominal emergencies like appendicitis, intestinal obstruction, etc. We have operated complex urological procedures like ureteric reimplantation. One very heartwarming aspect is that we have started operating pediatric cancers also.
Yeah.
So far the practice was that the child was operated elsewhere and would come to us only for chemotherapy and radiotherapy. But over the last 2 years we have been able to control that to some extent. We have operated Wilms tumor, that's tumor of the kidney, hepatoblastoma, tumor of the gonads, testicular tumor, ovarian tumor, and all of them, most of them are doing very good because they are on regular follow-up in our chemotherapy and radiotherapy departments.
Right. Right, that was great. That was a great talk and great discussion. So it was my pleasure having talked to you, and this discussion was very insightful. Any last comment that you would like to make on this World Pediatric Surgery Day?
Awareness is the only thing. People has to know that pediatric surgical conditions exist. Then you have to believe. The management starts with accepting the fact that you are having a condition, and that condition is treatable. So it depends on you. How soon you go to your pediatric surgeon, how sooner you consult him or her for the best outcome. That's it. Thank you.
Great. Thank you very much. So with that, we conclude our discussion, and we hope that all of you have a very healthy and fruitful life ahead. Thank you.
Thank you.